Hi everyone, it's Dr. Fox, and let's talk about the hepatic portal system. In this video, we'll discuss the hepatic portal system and differentiate between it and the caval system. We'll also identify examples of portacaval anastomoses. So the hepatic portal system is distinct from the caval system. Recall that a portal system is any vessel connecting two sets of capillary beds, and that the caval system is all of the tributaries of the superior and inferior vena cava, returning blood back to the right atrium. The hepatic portal system specifically is a venous portal system that collects all of the blood from the gastrointestinal tract. So that would be the distal esophagus all the way down through the rectum, and it distributes it up to the sinusoids of the liver. And from the liver, then blood is returned to the caval system via hepatic veins. Let's look at that in greater detail. So you may recall from our discussion of the inferior vena cava that its tributaries matched the branches of the abdominal aorta, with the exception of all of those anterior visceral branches that served the gastrointestinal tract. Well, in comes the hepatic portal system to take care of that blood. So when we think of all of the tributaries which would have flown through and accompanied inferior mesenteric artery branches, well, there is an inferior mesenteric vein, and that generally is going to drain into the splenic vein. Likewise, there's also a superior mesenteric vein draining the areas supplied by the SMA, and that is going to unite with the splenic vein to form the hepatic portal vein. That hepatic portal vein travels up to the liver, where it delivers its blood to hepatic sinusoids, and those nutrients absorbed from the gastrointestinal tract can then be stored, modified, distributed to the body, and that blood gets returned back to the IVC via 3 hepatic veins. So those hepatic veins are caval in nature. The hepatic portal vein is portal in nature. So thinking about this relationship mathematically, SMV plus splenic vein equals hepatic portal vein. Everything else is just a tributary into one of those two veins, either splenic or superior mesenteric. Now, with liver dysfunction and cirrhosis can come an increased portal pressure. What that means is an increase in blood pressure in the hepatic portal system. There are a number of etiologies that can cause this, but anything that slows the flow of blood will do. Now, when this happens, what happens is that portal tributaries can begin to enlarge and form varices. These varices can then form anastomoses with tributaries of the caval system that are adjacent. And we refer to these tributaries, anastomosing, as portacaval anastomoses. Now, portacaval anastomoses can occur in several different regions. So let's turn our attention here to esophageal varices. Now, there are esophageal veins of the caval system, and there is a left gastric vein of the portal system, and with increased portal blood pressure or portal hypertension, we can see varices forming here. These esophageal varices tend to be very diagnostic of portal hypertension. Now, we can also turn our attention to this area, the periumbilical region, so the region surrounding the belly button. So There is a para-umbilical vein, which can begin to expand, and they can form anastomoses with epigastric veins in that region. And this is a phenomenon that people refer to as caput medusae because it looks like the head of Medusa on an anterior aspect of an abdomen. These can form for a variety of reasons, but they tend to not be as diagnostic as the esophageal varices. And then finally, there are anorectal submucosal varices. So the superior rectal vein is part of the portal system. The inferior rectal vein is part of the caval system, and those superior rectal vein tributaries can expand and form anastomoses with the inferior rectal vein tributaries. So there is a mnemonic. It is not very empathetic, but when they refer to varices that may indicate portohypo, it's butts, guts, and caputs. Butts, guts, and caputs. Anorectal submucosal varices, esophageal varices, and caput medusae periumbilical varices. Now let's assess our knowledge. The hepatic portal system delivers material from which source tissues to the sinusoids of the liver? Is it A, the proximal esophagus? Nope. B, the GI tract? Yes, absolutely. C, the kidneys? No, that's caval. D, the lower limbs? That's caval. So B, GI tract, so that would be running from the distal esophagus through the rectum is the correct answer. Thank you so much for your time, and I look forward to talking to you in another playlist. Take care.